Hello everyone and welcome to the Pharmacy OSCE preparatory course. In today's video, I'm going to talk to you a little bit about what do we assess in students taking the OSCE exam. So as an assessor, what am I looking for in your answers that makes me give you 5 out of 10 or 10 out of 10? There are certain things, of course, that we are looking for. There is a checklist that we have as assessors that helps us assess your performance first of all, and also evaluate how did you do and give you a mark for your exam. So this is a very important lecture for all of you, because if you know what am I assessing, then you know for sure that what are the things to avoid and what are the things that you have to mention, and I have to hear it from you in order for you to get the full mark. So let's get started with today's video. I hope you will all benefit from this video. First, a brief introduction about the OSCE exam day. For those of you who have never taken the OSCEs before, the OSCE exam takes place across Canada on the same day. So you'll be examining or being examined in Vancouver, BC, and at the same time, your friend in Toronto will probably be examining too. Or maybe not at the same time, because there's sometimes time differences, but even though there will be a morning session and an evening session, so there's a morning session in Vancouver and a similar morning session happening in Toronto, and another one in Quebec, and so on. So this is basically how they conduct the OSCEs. They have mornings and evening sessions. Expect to be at the exam for about 7 hours, maybe less, maybe more, depending on how the day goes, but it's not going to be less than 6.5 hours. Before the exam begins, you are allowed to use the washroom if you want to go to the washroom. During the exam, it might be very difficult for you to go to the washroom, but it's not impossible, because the cases go from one case to another, and there are multiple students taking the exam at the same time. So you don't want to interrupt others' stations, you know. There will be some rest stations for sure, where you can relax a little bit, maybe eat or drink something. And yes, you're allowed to bring water and some snacks, maybe, that, of course, things that are not going to create a mess. And you, of course, like any other exam, you have to remove the labels from the snacks and from the water. Preferably bring the snacks inside a Ziploc bag. Maybe if you want to bring some biscuits or something and put it in a Ziploc bag and take it with you to the exam. That's okay, that's allowed, because it's a 7-hour exam, so you might get hungry or thirsty, of course, because you talk a lot in the exam as well. That was just an introduction. In order to get admitted to the OSCE exam, you'll probably need something called the PEBC admission card and a government issued photo ID, something like a passport, or if you're Canadian or a Canadian permanent resident, you can bring your permanent resident card or your Canadian driver's license or a Canadian government issued ID. If a female candidate cannot be identified, maybe some females are wearing veils, something covering their face. There will be 2 female exam personnel taking that candidate to a private room where they can confirm the candidate's identity. So they'll give her some privacy. They'll ask her to remove the veil so that they can see her face and compare it to the ID she provided. You will get your PEBC admission card about 3 weeks before the exam, so it's not something that you'll get right away. You must bring a lab coat with you, a white lab coat, a plain one, to the exam. And you should not wear any scented cosmetics or perfumes or clothing that have any smell, like any other exam in Canada. Some people are extremely allergic, so be careful. And of course, don't bring anything with peanuts or has peanuts in it. So don't bring a peanut sandwich as a snack, because some people are extremely allergic that they can sense the peanuts even from far away, and it can really affect them. All right, moving on. So inside the stations, there will be an assessor, right? We probably know that, or maybe we talked about that before. An assessor is present to observe the interaction and assess your performance using a scoring sheet. So each assessor will be carrying or holding a scoring sheet, and they will be marking it as you go through the station. Some stations have more than one assessor for quality assurance purposes, so one will be evaluating the other one, for example. When you arrive at the interactive station, you are required to peel off one barcode label from your sheet of barcode labels in your candidate notebook. The candidate notebook is something that you will get at the exam, just like any other exam that you have to put your name on and sign and whatnot. And inside the candidate book, there are some blank pages that you can write on. They will even provide you with a pencil to use during the stations, and you can even get more than one pencil through the exam. But inside the notebook too, you will have a barcode sheet with multiple barcodes that you have to tear off and give to the assessor as you enter the station. Only for interactive stations you'll do that. You will give the barcode label to the assessor after you enter the station, of course, because the assessor will be sitting inside the station. You won't see them outside the station. All right, and if there are two assessors inside the station, they may ask you to give two barcodes, one to each assessor. So everything will be mentioned on the sheet before you enter the station. Now let's get to the most important part of this presentation. Now, what gets assessed during an OSCE station? Now, there are different types of OSCE stations, and you will go through a lot of these types of OSCE stations in this course. You'll get trained on each and every one of them. But the very first one, the very common one, is the written prescription case. Someone walks in and hands you a prescription that they want to dispense. This is very common in the OSCE exam, and you must be very confident and able to get a 10 out of 10 in this case, because it's the most commonly seen station and the easiest one that you have to pass. There's no way. I'm not going to allow you to fail this station, all right? So the written prescription case, what do you need to do? What am I looking for? I'm looking for you to identify yourself. You need to identify yourself to the patient. Say, oh, hey, hi, my name is blah, blah, blah. I am the pharmacist on the shift, and I'd be happy to help you. This is how you should identify yourself. You shouldn't say your age or you're from this country or that country. We don't want that. Just identify yourself by saying your name. Hi, my name is Joe. I'm the pharmacist on the shift, and I'd be happy to assist you today. Okay? Obtaining the legal requirements for the patient profile. Now, there is something that happens all over the world, not just in Canada, where a patient walks into the pharmacy, hands a prescription to get a medication dispensed, but the prescription is not actually their prescription. It could be a forged prescription. So somebody wrote a fake prescription for a narcotic drug or a controlled drug and brought it to the pharmacy in order to get some of these medications illegally. So you need to obtain the legal requirements. You need to ask the patient or the person who hands you the prescription, is this prescription for yourself? Can I see an ID? What's your name? Of course, in an exam, they're not going to give you an ID because it's a fake patient, basically an actor or an actress. So what you need to do is to look at the prescription, see if it has a name, if it has all the directions, if it has the doctor's name and signature, if it has the clinic's name, if it has the address of the clinic. All these requirements are the legal requirements that has to be on any prescription, and not just in Canada, anywhere in the world. So you need to make sure that all the legal requirements are there, and you need to ask the patient, is it for yourself? What is your name? What is your date of birth? And compare it to what you see on the prescription. All right, so this is what a legal requirement is. And of course, when you do that, make sure to speak out loud. Make sure to be clear enough so that I can hear you. I'll be sitting behind you or at the corner of the room. So I need to hear you asking the patient all these questions. Otherwise, I would assume that you didn't ask them, and I'll give you 0. All right? So if you want to get 10 out of 10 in any of these questions, you need to make me hear what you're saying. So be loud. Talk loudly and confidently. Review the patient profile. When you get the written prescription from a patient, there will always be a profile in front of you on the table. That's something that will be there for every student walking into that station. So you don't have to remove it or anything. It'll be stuck to the table probably. You need to look at the profile and see if the patient dispensed the same medication recently, if they have any other medications at home, if there's any drug interaction between the two drugs, and you will have the references in the room, so don't worry about that. You don't have to memorize all the drug interactions, but I need to know that you are reviewing the patient profile. And the good way to do that is by saying, after you ask all the questions to the patient, tell them, okay, sure, I just have to review your profile before I prepare your medication, and that will take a couple of minutes, and I'll be right back. So I need to hear you saying what you're about to do so that I can mark it. But if you leave the patient and say, okay, I'm going to get the medication for you, and then you start reading in the profile, I don't know what you're doing. I'm sitting in the corner of the room, so I need to know what you're doing. So just speak out loud. Tell me what you're doing without even looking at me. You shouldn't be looking at the assessor or talking to them. But say what you're doing so that I can hear you and give you 10 out of 10. All right? Counsel appropriately. You need to counsel the patient. You're dispensing a medication right now, so you need to counsel the patient appropriately. And the good way to do that is to go through all of these points. Identify the patient, ask for the name, for the date of birth, identify the dispensed drug. What are you dispensing? I'm dispensing ciprofloxacin, for example, 500 milligrams, and you should take 1 tablet or 1 pill twice daily by mouth with a few sips of water, and so on, so on, so for how many days, all of these things. You need to explain how to store the medication, the most appropriate way to store the medication, whether it's at room temperature, it's fridge storage, and away from children. You need to explain the possible side effects, how to minimize those side effects or avoid them. You need to, if possible, of course. You need to ensure the patient's understanding. You shouldn't be talking, giving too much information, and then not asking the patient if they have any questions. You need to know if the patient understood what you're talking about. What you don't have to do is ask the patient to repeat everything you said, because the patient is not really listening to you. They're an actor sitting there just pretending to be a patient. They're not really listening to what you're saying, and they're not going to do anything you said. So you don't have to ask the patient or the actor to repeat everything you said. And then you have to use appropriate verbal and nonverbal communication. So if you have to explain something without saying it, like by showing it to the patient, you should use that. So for example, counseling a patient on a puffer, something like Ventolin puffer, or Advair or anything like that, a discus puffer, wherever. You should show the patient how to use it, how to blow the air, how to inhale it into the lungs, and so on. So you should show the patient how to do it and act while you're doing it, okay? So this is basically each one of these ticks will be marked from 0 to 10, as it shows down here. 0 is poor, and so on. It goes up to fair, and then the good mark would be anywhere between 8 and 10. That would be a good answer, and you would expect to pass the station if you get a good mark. Some students pass if they get a fair mark too, like maybe 5 or 6, but they scored really high on the other stations. So it's a cumulative score. And of course, we compare all students together, and there is another score at the end of the OSCE. So these are not the only scores that you're going to get in this exam.